Hello, I'm Bob Mayne from Handgun World Podcast, and joining me, Ben Branam from Modern Self Protection. Ben, welcome.
Hey, everybody. We're here with a special guest with John Edeen, the guy from
Doctors
Doctors
for
for
Responsible Gun
Responsible
Ownership.
Gun Ownership.
And
You know, I'm just,
2adoc.com,
and
too.
yeah, so he's
Yes.
got a lot of things going on. I'm all flustered because we are going to talk about a really scary topic for me and how this virus and stuff actually works. So we got the person that we know the best, the doctor. He's one of the smartest guys I know, and he's been studying this stuff. He's not an infectious disease expert, but he has 10 times the knowledge of this that me and Bob do together. So we called the person that we knew had the most knowledge and the smartest person we could find to give it to you.
So,
So, John, welcome
yeah,
aboard.
welcome aboard, John.
Thanks. It's good to be here. I'm glad that we could get together and talk about this. I think this is an important topic, and I think it's important information for people to know because we all have questions about this thing. You know, what's going to happen? How does it happen? How do we keep from getting it? Are there treatments? All the kind of the good and the bad, the ugly. That's what we're going to talk about today.
And before we get started on that, John, this video is getting posted to a lot of different sources. So there might be people that are not used to listening to my podcast or Ben's podcast. Spend some time telling people who you are. What do you do?
Okay, so my name is John Edeen. I am a pediatric orthopedic surgeon. I am a private practitioner. I've been in San Antonio for coming up on 23 years now. And so, when this COVID-19 thing showed up, because I'm in the Second Amendment world and I'm a doctor, I figured I'd better study up on this because I know people are going to be asking me questions.
Yeah.
And so, and I do have a very good friend who is an infectious disease specialist in New Jersey, actually. His name's Sandy Berardi, and he is the co-host of Gun for Hire Radio. And so he and I have had a few conversations and a few, text exchanges. And he's also commented a lot about this. Also, another really good source, which is out there, is ZDog MD. And he does a lot of videos. He has a podcast. And some of the information I'm going to talk to you about, I got from him. And I know he's in San Francisco. I'm not sure exactly what his specialty is.
ZDog MD, right?
Yeah, ZDOGGMD. And he's the guy that did the My Corona video, which
you
talked
said
about
that to me. Yeah.
Right. Yeah. And that's hilarious, but he's also got a lot of very serious stuff. And I think he's a worthwhile person to take a listen to. And so let's talk about what is coronavirus.
Okay.
Okay. So coronavirus is actually a bunch of different species of viruses. The most common one that we know is the common cold. That's a coronavirus. There's kind of coronavirus A and coronavirus B. The group B viruses are things like SARS and MERS, and then the COVID-1, which I think was SARS, and now we have the coronavirus 2, and that's the one that we're dealing with right now. And
Okay. Hold on one second. Explain to people, what is SARS?
It was a
Severe acute respiratory syndrome, right?
Right. It's a viral disease caused by an earlier version of a coronavirus. And MERS was Middle East, which is another coronavirus.
Middle East respiratory syndrome.
Right. And so we have multiple outbreaks of these types of viruses. Okay. And apparently this virus is very similar to ones that we find in bats. And there may have been another animal that helped to bridge the gap. And some people are talking about the pangolin, which is kind of an anteater-like critter that the Chinese like to eat. And so that may have been part of the bridging thing. Now, this virus is an RNA virus, which means that you have DNA and RNA. DNA is your genetic material. RNA is transcribed from DNA, and then there's something called a ribosome that transcribes the RNA into proteins. Okay, so what this virus does is it's got what's called spike proteins. That's why it's called the coronavirus, because it looks like a crown.
Mm.
These spike proteins, they attach to something called the ACE2 inhibitor. I mean ACE2 receptor, and that stands for. Oh, hang on. I'm thinking of the wrong thing.
Well, let's go back to.
Yeah, I can't think of it.
The virus. It looks like a crown. That's where it gets its name.
Right,
so
and those are the little spikes.
Spiky things that
right,
go out,
the little spiky things are what attach to your cells, to these receptors, and they're the angiotensin converting enzyme 2.
Oh, I knew
Say
that.
that 3 times twice.
That's what it is. But well, there's a lot of antihypertension drugs that actually take advantage of this. I'm on one of them actually, and so there are drugs that we use that manipulate the angiotensin converting enzyme. So anyway, this thing gets inside your cell, and then the RNA, because it's a positive strand, which means it has the message on it, hooks up with the ribosome and makes proteins and makes more RNA, and then it rebuilds the virus, and then it's kicked out of the cell, and where it infects more cells. And so that's how viruses work. They take over your own machinery to replicate, and then they destroy the cells. And so the first stage of this is the infection and destroying the cells. The second stage, and that's when you get the symptoms of the fever and the cough, and there's receptors in the lungs, in the GI tract, in the heart. And so that's why people with, heart disease are at higher risk. In fact, there's probably one of the theories is that the body's immune response, you flood the body with something called cytokines, which are chemical messengers, and that causes the body to be overwhelmed, and then it knocks off heart muscle and kills you. So there's the initial response, and then there's the cytokine response, which has to be modulated. And so, like what's going on right now in the United States and the world, the initial infection is bad, but the response to the infection is actually maybe what kills you.
Okay.
So it's kind of like the economy, right? So we shut everything down, and all of a sudden, all the businesses are out of business, people are out of jobs, nobody's got an income, and that's actually the bigger problem. And so there's a similarity between the actual viral infection in your body and how we're dealing with it.
Okay.
So that's the first part of this. Fever is a major sign, and the white blood cell count may be low or normal. And there's a bunch of other laboratory tests that I'm not going to go into.
The WBC might be low?
Yes, because it's a viral infection. A lot of times you don't get a high white count. In fact, if you do have a high white count, you may have a secondary bacterial infection, because that can happen with these as well.
The bacterial infection would make the white count go up, right?
Right.
Okay.
Right. Okay. So that's, the thing. Now, how does this thing get around? Because this is the important thing.
That's a good question.
Most of the transmission of this is droplets. So when we breathe in and out, there are microscopic droplets of moisture that get blown into the air, and then they'll settle down on a surface. And so that's why we're talking about that 6 feet social distancing thing, because that's about the size of the kind of the cloud of steam that you're breathing out, essentially. Okay. And that's also why we want to clean surfaces and wash hands, because if you pick it up on your hands off a surface and put it in your mouth or your eyes, then it can get in your body and start to infect things, and they go to your lungs and go to your GI tract and go to your heart and other sensitive organs too.
Hey, I got a question for you on that, John. Is there any information on how long it lives outside the body right now?
Actually, there's actually some good information. On copper, it can last 4 to 8 hours. On cardboard, up to 24 hours. On stainless steel, 48 hours. On plastic, 72 hours. And on a paper towel, it's probably something less than cardboard. So maybe 18 hours or 12 hours. It just depends
That's a
on
long time on all those
Yes.
surfaces.
So it
And
sits around. But the nice thing is
longer
that
than the cold and stuff, right?
right.
Is that longer than normal?
I don't know.
Anything else? Okay, that's fair.
I don't know. But the nice thing is that it's very sensitive to UV, so ultraviolet light. So sunlight will kill it, or UV light. Detergent and other solvents and things like alcohol will kill it because it's an encapsulated virus. So if you can damage the capsule of the virus, it makes it so it can't get in the cells, and then you won't get an infection from it. Also, there's a tenfold decrease in the viral viability by raising the temperature 10 degrees Fahrenheit. So if you raise the temperature, it may start to inactivate some of the virus, and it may be because it's drying out and it's damaging the spike protein, so they can't get into the cell very well.
So John,
so
is it
bring on
logical?
the Texas heat?
Yeah, I was going to ask, is it logical to assume that in hotter climates, it could potentially be less problem?
Yeah, I think that that's how we get seasonal viruses. The problem is with world travel, it'll just go to the southern hemisphere, live down there for a while, right? When it's hot here, it's cold there, and then it'll come back again.
Yeah.
However, next year we'll probably be better prepared, and so we're not going to have to lock things down, and there are several treatment strategies. One is this trying to isolate everything, try to keep things from spreading. The other one is to isolate the people that are high risk and let it run the course through the population and let people get immunity. And so we are kind of in that isolation phase right now, but the question is, when do we go to that next phase? And it's hard to answer that question because we don't know the natural behavior of this virus.
Okay.
We're still learning, right? We're learning from China, we're learning from Europe, from France, from Italy, from Spain. And those are the difficult questions to ask. Now, there is an interesting phenomenon that happened back in February. There was a ship called the Diamond Princess, and it had 3,711 passengers on board. One of those passengers had the coronavirus, the COVID-19 virus. And this is when all this stuff kind of broke out. So they realized, okay, we got a problem here. And it turned out that when they tested everybody on the ship, after 2 weeks, 634 people tested positive for the virus, but 320 of them were asymptomatic. So about half of them were asymptomatic, and only 17% of the population got the virus.
17% of
right.
the 3,200.
Of the 3,700, yes.
3,700, and they were on a big ship with a bunch
right.
of people on it.
And it turns
take
out
any steps, or did they just?
Well, they were trying to isolate and that kind of stuff. The thing is, some of the people that had it were the people who were preparing food. So the cooks on the ship, a bunch of them, because they all lived in the same area, they passed it around, and so they and some of them were still working because some of them weren't very symptomatic, and so they're passing on the virus. The other thing about this thing that people have to understand is that you can be not sick and pass on the virus.
Yeah.
And so you have to understand that there's a lot of asymptomatic people out there who are spreading virus. And this is the big problem with this thing, because most of the time when people understand if they're sick, they should probably not go to work. They should probably stay home and not interact with people. But with this, you feel fine, or maybe you feel just a little bit off, or whatever. And here in South Texas, with all the oak pollen and the mold right now.
That's what's killing me right now.
None of us feel really good.
No.
So the question is this the allergy thing, or is this, the COVID-19 business?
Yeah, and John, that's been going through my mind a lot for the last week, because I believe these allergies are kicking my butt, but it's in the back of my mind because of what's going on right now. Oh, could it be a bigger problem?
Right. And fever is your big differentiator.
I don't have that.
So if you have a fever, of at least 100.5, maybe even up to 101, those are kind of cutoff numbers. Then you should call your county health department and ask them what to do, or your primary care doctor if you have a primary care doctor. Because in order to get tested right now, you have to get a kind of a referral from your doctor in order to go down and get tested. And in San Antonio, they're doing it at the Freeman Coliseum. There's a testing area there, and so everybody's masked up and protective equipment and all that kind of stuff.
But I would have to get a referral from my family doctor before
Right.
they'll test me.
Correct, because you have to
and
meet whatever criteria. The fever, the cough. They're going to ask you a whole bunch of questions and find out if to try to differentiate between the allergies and the COVID-19.
Well, and then that's a good thing, because I mean, this is a problem you have around the hospital, John, is that one person gets sick and passes it to everybody else. So if everybody goes down to that area to get tested right now, half of the people there are infected with COVID-19, and they're going to pass it around to people that aren't. So, we take these controls and go, this sucks that they won't let me get tested.
Right.
Well, you don't need to go anywhere near anybody that has this thing if you don't have a reason to.
Right. And now, me working in a hospital, I have to go near people because I still have to see patients. I have patients that I'm in the middle of treating that have had surgery so what we do is the first thing we do is when they hit our front door, before they even come in our office, we check their temperature and we ask them some questions. Are you having fevers? Have you traveled, recently? All those particular questions that we need to ask. And if the answer is no and their temperature is normal, then they can come in. Everybody in our office is wearing a mask. Now, we're not wearing N95 masks. What we're just doing is wearing typical cotton masks or surgical masks, because what we're trying to do is if any of us are sick, we don't want to pass it on to any of our patients, especially some of our special needs kids who have respiratory issues, who have immune system problems. I got kids with leukemia that I take care of. I have kids with cerebral palsy, and some of those kids have significant respiratory problems. And so what we're trying to do is protect our patients. The only thing that may protect you to some degree is the N95 mask. And unless you have it fitted and are doing it right, it may not be protective either.
John, I want you to pause for a minute because I want to talk about these masks. When I go to the grocery store and I see people walking around with gloves and just the blue cotton surgical masks, is that mask doing them any good?
Well, it's not doing them any good, but what it's doing is you something good. Because if they have the COVID-19, because remember, it's droplet spread, right?
It makes it less likely for me to get it.
Right. So the mask absorbs the droplets so they don't end up on surfaces that you can pick up. And so it's actually a courtesy to you. Now, the gloves, unless you take gloves off properly, you're still going to contaminate yourself. There's actually specific techniques for removing gloves without contaminating yourself. Gloves have a clean side and a dirty side, as we like to say. The inside's the dirty side and the outside's the clean side. Okay. But once you start touching stuff, then it kind of reverses.
Yeah.
So the inside is clean and the outside's dirty. So what you don't want to do is take the dirty stuff and put it on the inside of inside of your glove.
You don't want to touch the inside of your glove with a dirty finger from the other glove.
And so so you don't want to stick it inside the glove. You want to peel it from the outside.
From the outside, peel it off.
You want to grab it kind of at your palm,
yeah,
and then peel it off
without touching your skin.
And then the other hand, now you have a hand without a glove. That one goes inside, and then you can peel it off. And so that's how you keep from contaminating your hands with gloves. Now, you can still transfer virus with touching things with the glove. So.
Well, you just explained. Go ahead, Ben.
I saw somebody at the store scratching their face with their gloves on.
Yeah. So there you go. That's not really helping.
That's not working.
Didn't you just explain earlier, John, that the virus lives on surfaces for quite a while?
It does. And
so it's going to live on the gloves too, right?
Exactly. So that's the thing. That you don't, unless you understand what you're trying to accomplish with these protective equipment, you may be defeating it. Just by certain behaviors, certain things you do. That's why you need to get training. Exactly right.
Well, and you need to get help too, because I know one of the things that all of us do all the time is you scratch your face. And it takes a lot of time for me and John in the military to be broken of that habit during boot camp. And that's
Yep.
with 15 people yelling at you about it. You around the house, you do it 20, 30 times a day and don't even notice it, maybe
Right.
15 times an hour. When you go
And so-
outside, you have the same habit.
So
So
what
if
you
you go
do is
outside
you-
with your friends, is you start
Yeah.
smacking each other. No, I'm not.
Yep.
I'm kidding. Don't smack each other, but remind each other. Stop touching your face. Stop touching your
Right.
face. You'll be
Exactly.
surprised how many times you do it. Just have your significant other or your friend tell you how many times you're touching your face.
Right.
Watch the video and see how many times we touch our face, because I know I already did it.
Me too.
So you wash your face. Wash your face. You wash your
Wash your
hands.
hands.
You clean surfaces, and you do that. You wash hands several times a day. I wash my hands with each patient going in and out of the room, so that I'm not bringing stuff in and I'm not taking stuff out. And so that's what I do. And the alcohol-based hand sanitizers are good, but actually soap and warm water for 20 seconds is probably better.
Mm-hmm.
And so, that's what they recommend. Getting back to the Diamond Princess, out of all those people, only 8 people died, and they were all elderly. So you have to understand that it's kind of a skewed population on those ships. Now we have another one too. One of the aircraft carriers has some guys on it now with COVID-19. They're a younger, healthier crew. So this is going to be another kind of test tube study once we figure out what's going on with that thing. Fortunately, a group of young, healthy guys, most of them aren't going to be affected very much. Although some young people have had some issues with, if you have a little bit of asthma, or if you recently had something else, it may, make you a little bit more susceptible. So it'll be interesting to see what happens on that aircraft carrier.
Yeah, that's younger people. I guess that's a little on the scary side.
Well, it's not. And when you think about it,
No?
because they're the ones that don't get really sick.
Okay.
Those are the ones that don't have a high risk of fatality. Whereas on this cruise ship, there was a bunch of older folks and 8 of them died out of the 3,700, which is still a relatively small rate. But it's because, you have a higher percentage of elderly people on a cruise ship. I don't know if you've ever taken a cruise, there's a bunch of old folks there. They're having a good time.
I've taken 2.
Yeah, no, I have too. And so you understand. So when you look at kind of a lot of the studies, influenza has about a 0.1% fatality rate, or 1 in 1,000. And COVID-19 may have a 0.5%. So maybe 5 in 1,000. Although these numbers are fluid because the denominator of the deaths per case is unknown, because we're not testing everybody.
Right.
Now, as we get more testing, and there's a company in California who's making a test that's actually going to get out there, I think, pretty quickly, and it's maybe an hour to turnover, and it can be done in medical offices and things like that. That may help us sort out the numbers. So the more people we're testing, then we can probably move on to that second phase, which is test as many people as we can and isolate the ones that are positive for the virus, and also isolate people who are at high risk for getting bad outcomes with the virus. And that way everybody else can get back to work. And that's probably how we're going to get out of this.
Well, I hope so. I hope that's how we're going to get out of it. John, I saw something on the news just this morning about a test that renders a result in about 15 minutes or less.
Yeah, you may be able to do that. And again, we're unleashing the capitalist economy out here.
Mm-hmm.
We got people who are smart, and they're not doing this stuff for free. I can tell you that. Okay.
No.
And so their companies are going to make money off of this, and that's not greed though. That's just making a product that somebody needs.
Well, they deserve to make money if they're making a product that's going to heal people or prevent something, or
keep the economy from going all the way down the toilet.
Which we're close to that now.
Yeah,
right.
At this point, how much would we each pay for a pill that would keep us from getting sick?
Right.
How much would that pill be worth right now?
So let's talk about that. Okay. So there are some drugs out there. First of all, there have been some, I would say, anecdotal reports that people who are taking non-steroidal anti-inflammatory drugs actually have a worse outcome. So avoid, ibuprofen, Advil, Motrin, and also like things like Aleve, which is naproxen.
Naproxen.
Right, those anti-inflammatories may actually cause a higher death rate. So there's a drug called chloroquine
Hydroxychloroquine.
or hydroxychloroquine. They're analogs of each other. They're old drugs. They've been around since the mid 1940s.
Brand name Plaquenil.
Right, that's hydroxychloroquine.
Yep.
But those drugs are anti-malarial drugs, but they're also used for arthritis. And so they've been around and they're fairly plentiful. And there are some small studies and there's a lot of question as to whether these are good studies or not that show that actually it reduces the viral load. And when you combine that with azithromycin, which is like a Z-Pak, right, Zithromax, it is actually even more effective. In fact, they're doing a trial in New York City probably, of that combination. So we'll be able to see if that doesn't help. Okay, so a lot of this is kind of new ground, but a lot of this stuff was done on the first COVID, or the coronavirus type 1. I guess it was the SARS. And so there's another drug which is a antiviral called remdesivir, I should say.
Remdesivir.
And that was developed, remdesivir, which was developed against Ebola. And they found that it helped with MERS and SARS. And so that's another thing, but that's not in plentiful supply. But that's not interesting. That's interesting. There's also a vaccine. A company in Boston has came up with a vaccine against the mRNA of the COVID virus. And so they're probably going to be testing that I think it's going to happen up in Washington State. So they're testing vaccines. There's a couple other antivirals that are not promising, lopinavir and I think it's ritonavir, I guess, or ritonavir. Mm-hmm. They don't work. Now here's a plug for my college and medical school. There was a guy when I was at Columbia College back in the late 70s, early 80s, a year behind me. He was a light crew guy. His name was George Yankopoulos. He graduated from college, went to the MD PhD program at my alma mater, Columbia College of Physicians and Surgeons, and he founded a company which is making antibodies to the spike protein using a specific type of mouse that they've used that makes human antibodies. So our body will recognize these as not being mouse antibodies, but human antibodies.
Wow.
And so this is something that's promising as well. So there's stuff is happening. I mean, if you think about it, this has only been going on for a couple of months, and all this stuff is happening. And this is the power of actually medical technology.
Well, and I think it's, in addition to medical technology, don't you think, John, that this is also the power of the free market capital system?
Absolutely.
Capitalistic system.
Excuse me, I'm going to drink a little water.
That's okay. I think I'm going to do the same.
Because we got all of these evil capitalists doing all these things. All these companies are switching over. Even a T-shirt company switched over to start making masks for people so that we could get stuff out and help first responders and everything. So our capitalist society works.
Yeah, My Pillow is doing it as well.
Oh,
Mike Lindell's company, My Pillow.
And then here's another interesting thing. When we take surgical instruments and sterilize them, we pack them in this blue kind of papery cloth stuff. And there's usually two layers. There's a outer layer and an inner layer, and we put indicators on to make sure that it's had enough temperature and steam. Well, those masks actually have a higher. If you make a mask out of one of those with two layers of that stuff, it actually has a higher rating than an N95. And so now people are looking to take that paper and use that to make masks. And so there's a lot of ingenuity out there of people making things that are going to be effective.
Okay, so John, I wanted to ask you something because I don't want to get off this subject about our free capitalistic system coming up with solutions here to what we're facing. I was sent this morning a very sobering video from a doctor in Spain. He recorded a video, and actually on his video is another doctor, and I think they're both ER doctors in Spain. And what he's talking about, and he's crying on the video. I'll put this on my Facebook page if anybody wants to watch it. He's crying on the video because of they're having to ration ventilators, and he's crying because he's watching people 65 and over die while he's being instructed to use the ventilators for younger, more healthy people. Um, is that? I mean, people who are in favor of the single payer socialist system, isn't that what happens?
Absolutely. In fact, Italy's the same kind of thing. They ran out of ventilators. They didn't have the stuff. Even like New York State, we just found a whole warehouse load of ventilators in New York that weren't being distributed. So what the heck? What's going on there? We're sending them stuff, and they got stuff in a warehouse that they're not even touching. Are they saving it for a disaster for later on, or what?
Yeah, that's a good question. Why aren't they using them now?
Exactly.
Every government breaks down to Animal Farm.
Yeah.
Some are more equal than others. And I hate to say it, but when government starts hoarding stuff like that, it's probably because they're waiting for the people that are more equal than others to need them.
Yeah.
It does make you wonder. And what's even more alarming about this video, I mean, you got to go to my Facebook page, and I'll put a link underneath the video description here so that you can watch that. What's even more disturbing is this doctor, he's actually, I like what he's doing. He's calling upon the Chinese government. He's basically saying, hey, you folks are responsible for this. So it's time for you to start helping me and my country fight this. I don't know how much luck he's going to get with that, but, he's calling upon it.
Right. And frankly, we can't really count on the Chinese government to tell us the truth.
Right.
Here's the interesting thing. They have a bio-research laboratory in Wuhan. And I wouldn't be surprised if this thing got out. And that's why they initially tried to suppress it. Because remember, the first month of this thing, they were, the guy that kind of blew the whistle, he kind of disappeared for a while. He ended up dead.
Well, the Chinese government killed a lot of people that had
Right.
COVID-19.
Right.
That was on the news. They were, I think that was their first technique to try to stop the spread.
Yeah. And interestingly, I read an article yesterday that, pretty much everybody in China has a cell phone. Well, there are like 2 million less cell phone accounts right now this month than there were 2 months ago. So I'm not sure. So, I mean, what does that mean? I don't know, but it certainly makes you want to speculate. And since, there's not a free press there, you're just going to get what the government wants you to hear.
I hate to stand up for the Chinese government here, but I'm going to.
Go ahead.
Mean, they're in the middle of this for whatever happened, however it started. They're in the middle of this just like we are. America's not going to ship ventilators to Spain because we need them right now. China is almost on the downside of this. So this doctor asking China to help him is just like, you're in the middle of this right now. Italy's being hurt worse than Spain is. Are you going to send your ventilators to Italy to help them out?
Well, he's emotional. The doctor's emotional, and I can
every
understand.
Government's gonna. Right. Yeah, he's just pissed off, is what happens. And
he's downright distraught because of what he's having to deal with there with the rationing of care.
Well,
right. And being in the middle of that triage situation, it's very difficult.
There you go.
Because you don't have the resources. Yeah, you don't have the resources that you need. Basically, being a doctor on a ship, I had what I had, and there was no resupply. If you're out in the middle Pacific Ocean, if you don't take it with you, you're not going to have it. And so this is the problem that they run into, is they don't plan for these things, and when they happen, they're caught short. And so then you have to start making very difficult decisions.
Horrible decisions.
Yeah, they are horrible decisions. But if you look at the government, they're going, well, do we waste resources on old people who aren't going to be around for more than another 5 or 10 years? or do we use the resources on people who have 30 or 40 more years of life and are likely to get through this? And that's what triage is all about. So
yeah, and then you've
they're
got the
doing
doctor.
triage.
Yeah, the doctor doing triage. He just looks at two people. He has one ventilator and two people that need it. Well, this guy's more likely to survive than this guy, so I'm going to give it to this guy.
Yeah.
It's a horrible, horrible decision.
The problem is
Wherein
he
if you
shouldn't.
had-
He should have two ventilators instead of one.
If you had to, they could probably both survive, but you got to
Right.
look at it and go, you
Yep.
make you got what you got, and it's a horrible situation. But hey, these are why we need the capitalist society, so that we can have companies like Ford just turn over and start making ventilators. There's a bunch of companies that are just doing that. They just started making them. Government
Yeah.
didn't have to ask them. They just started doing it because they
just
knew this was
started
going to
doing
be
it
a
on their
problem.
own.
Right.
Yeah,
So-
Because there's a need, and you know, it's not like they weren't going to be able to sell them. You know,
Yeah.
They're not going to be stuck with them. People are
And
there's
good
going to
on
be a
those
demand.
companies. Good on those companies for doing that. John, what
Right.
kind of lessons? What kind of lessons do you think that our government and our people are going to learn from this?
Well, I think the people need to learn this because the government is going to answer to, you know, what we demand. So the first thing is, the silver lining is this. One, we're going to have less influenza cases. And remember, more people die from influenza than are dying from COVID-19. So that's the first thing. And we've already got like 20,000 influenza deaths this year. So there'll be less because the virus is spread in very similar fashion. This has uncovered the vulnerability of our supply chain and being dependent on China. You know, we depend on China for drugs. We depend on China for N95 masks, the material to make those. Even if we manufacture them here, the materials come from China. And so this has really kind of uncovered the kind of the fallacy of you know, being dependent on China, who is not our friend, by the way. You remember that.
Exactly right.
They are our competitor. They're not our friend. And so we need to start looking at producing all this stuff here. You know, it's interesting because I see a lot of times, you know, we have drugs that are in shortages, and we never used to have that. I'm trying to like, why are we short on drug A? We've never had a shortage on that. And these are common drugs for nausea, sometimes IV fluids. You know, when that Puerto Rican hurricane hit, we got a lot of our fluids from Puerto Rico. You know, our IV bags, they came from Puerto Rico. All that stuff all of a sudden dried up. So the only place we were getting them from was China. Okay, so now you know, that hurricane made us more dependent. So we need to have home production. So I think that's kind of the silver lining here is I think we've seen that we're vulnerable. And also, look at the number of new gun owners.
Oh yeah, let's talk about that.
You know, the stores, the gun stores are, some of them, the shelves are empty because they've sold all their guns.
Yes.
And a lot of these people are new people. Also, people in states like California and New York and some of the other states, they found out that you just can't call on the internet and have somebody deliver a gun to your house.
How
yeah,
about that? You cannot do that.
You got to go through the background check, and in some states you have a 10-day waiting period.
And it has to be shipped to a dealer locally. They
Right.
can't just ship it to your house. It
Right.
doesn't work that way. And a lot of these people who have been voting the wrong way for gun rights, they've been voting for these politicians that are restricting their rights. I think a lot of people just never really knew exactly what it took to buy a gun.
No, they heard what the Bloomberg propagandists are telling you.
Right.
You know, and you know, they didn't. You know, oh, it's easier to get a gun than it is to get a book at the library or, you know, vegetables.
Who was it Obama that said that? I think.
Yeah, I think so. Yeah.
I think he said that it's easier to get an AR-15 than to get a book or something like that.
Yeah,
Yeah,
book
no,
at the library, because he said you had to have a card to get a book at the library.
Yeah. Yeah.
So-
As if
so-
all you got to do is give me a break.
Yeah,
But that is a fun thing, because all those people will never believe any of that propaganda again. They'll be like, wait a second, I went to go buy a gun during the COVID-19 scare, and I had to do all the background check and couldn't get one.
I guess that's a silver lining right there.
To me, that's
Right.
a silver lining, because all of a sudden we won't believe the mass media that has just been lying for 25. Well, I'm trying to think. it was probably, in the early 90s. So we're going on 30 years that they've been lying to us about this.
Right. And so that's it. And that now we have all these people. Hopefully we can get them, train them so that they're safe and that they know about safe storage and safe, all the 4 rules of gun handling and all that kind of stuff. And so, we may be able to take advantage of this to grow the 2A community. Now, I don't expect all of them to do that, but a percentage of them I think will. And so,
well, I think so. I think you're right. A percentage of them will. And I think another good benefit that we have here is people, I think, are waking up and figuring out, as far as at least their self-defense, they're on their own.
Oh, yeah.
I think this crisis is making them finally realize the government is not coming to take care of you. They can't even get enough COVID-19 tests out there. How do you expect them to take care of you and your family if you're threatened?
Right.
Yeah,
and I agree.
Some of the municipalities are even saying that we are not going to respond to these calls. We don't need our first responders exposed to what might be a problem. So
we're emptying the jails too. We're going to actually take criminals and let them out.
Exactly.
Quote unquote nonviolent.
Right.
What does that mean?
A burglary is nonviolent until somebody walks in on them, and then it's no longer a burglary. Then it becomes, assault with a deadly weapon, attempted murder, that kind of thing. So nonviolent.
And Dr. John,
that's probably about it.
Dr. John, tell people who are not familiar with you how much of a gun enthusiast you are.
Oh, I am very much the gun enthusiast. I'm a training junkie. I've got over 1,000 hours of firearms training. I've taken all of your classes.
Yes, you have. And you're also the membership director for Doctors for Responsible Gun Ownership at drgo.us, right?
That's correct.
drgo.us. I'll put that in the show notes. And then you're also affiliated with another organization called 2adoc.com.
That's actually part of DRGO, and that's a service that we have where we match up Second Amendment friendly physicians with patients who want their privacy and their rights respected. And right now, we're looking for primary care doctors because we're a little bit short on them, and that's the thing that's in most demand. So if you're a internist, a pediatrician, a family doctor, and you are a 2A friendly person, you want to have access to a whole new group of very like-minded people, and it's free and it's private, so nobody can search the website. We match up doctors and patients. Those are the only 2 people that get the email. And so it's something that we can do to help put people together. And I think that's a nice service. And that's Arthur Perspinda is the one that came up with that, and he kind of runs that for our group, and he's the project director.
Good deal. John, we very much appreciate you bringing the physician's perspective. And as I mentioned in the beginning of this video, even though you're not, your specialty is not infectious diseases, you really gave a very, very good, several nuggets of good information that I had no clue. So I'm glad you covered that. And you seem like you got your finger on the pulse of this pretty well.
Yeah, I've been studying. Got nothing else to do because there's no elective surgery. So
there's no elective surgeries.
Ben and I riding bikes and studying about the coronavirus. That's what I've been doing.
Well, we're all finding things to do, and since we're talking about finding things to do, for anybody who's a member of our Shooters Club, Ben and I just put up a video last night on how to coach new gun owners. If you happen to be approached, even you, John, if you happen to be approached by a new gun owner saying, hey, can you help me out? I don't know what to do with this thing. On the Shooters Club, there's a real good video for that. And I'll put a link in the show notes here as to how people can join our Shooters Club. Okay. Ben, anything you want to add?
No, that would be fun. John is wearing a TacCon shirt right now. I'm very jealous. That's the tactical conference that goes on every year. John and I had tickets. We were supposed to go up, and we were supposed to be there right now.
And I wanted to go
unfortunately,
there.
It got canceled. I was very sad that it got canceled. I was crying in my Wheaties.
Is it actually canceled or postponed?
Oh, well, no, it's canceled for this year.
It's canceled for this year?
If you're already have a ticket, you can transfer that ticket to next year. And
so that means next year's already sold out then.
Not necessarily, because not everybody is transferring. Some of them are getting a refund.
Oh,
and
okay.
But as soon as you get the word that it's open again, don't wait.
No.
It's worth it. It's like $400 and something next year. But that's actually some of the best money you'll ever spend on training. Yeah. It's 3 days with, I don't know how many instructors, but there's
50 or 60 of the top trainers come in and they teach. And I normally take a bunch of the classroom stuff with a little bit of the gun stuff thrown in, but it's great. We're turning in an advertisement because I'm sad I missed it, but it's definitely worth your time. Bob, you're going to have to go in. Can we tattle on Bob right here, John?
Yeah, go ahead.
Yeah, go ahead. Tell him.
So I invited all these guys over to Thanksgiving dinner last year, and we were talking about it. And me and John were sitting there, and we're like, you know what? We should just sign up. So me and John sat there on our phones and signed up and put a ticket in. Bob's like, I'm going to do it. And then he waited like 3 weeks, and it was sold out.
Not even that. I think
okay.
About 2 weeks or something like that. It was sold out.
So this time you'll listen to us when we buy tickets. You'll just buy a ticket.
As soon as, like John said, as soon as I get the email, I'm going to click sign up.
Yeah, and it's in Texas too. Next year as well. Same place that we were going to have it.
Oh, they're going to keep it here in
Carrollton, Texas, at the Texas.
Okay.
What's the name of the place?
Dallas Pistol Club.
Dallas Pistol Club.
I used to shoot there once or twice a month, and when I was living in the DFW area, it's a nice place.
Yeah. Oh, and by the way, for those who heard our interview, there's the X5 Legion with the Romeo 1
Move it over
Pro.
just a little bit more to you. Yeah.
I'm going to be jealous now.
Romeo 1 Pro.
Really.
And Bob and Ben, you are both welcome to shoot it. And here's another interesting thing. I scored a 21 round magazine.
Oh, hello. Hello. Like yeah.
So,
people in California and New Jersey and New York and Connecticut, they're very jealous right now, I think, that are watching.
Yep. Yeah.
But that's a beautiful gun. That's great.
Yep.
John, any last thoughts? Leave us with some last thoughts.
Wash your hands. Wear a mask if you want to protect other people. Don't scratch your face and pick your nose like Ben does all the time. Yeah, keep your fingers out of yeah. Also, some of the symptoms that you need to be aware of besides the fever and the cough, there are some GI complaints that you can have, like diarrhea or nausea and vomiting. And
really?
also, yes, and in China, maybe up to 40% of people have that. And here's another one, loss of smell and taste. Some of the ENT doctors are starting to report that. So those are the symptoms that you're looking for, the fever being the most important thing. If you have a fever, take Tylenol, do not take ibuprofen. Also, things that you can take, vitamin C, zinc, magnesium. Those are things that you can take to help kind of boost your immune system a little bit.
I've been taking a vitamin C every morning for the past 4 or 5 months.
Good. But
wow.
Keep doing it.
Okay.
And you can do big doses as long as your GI tract can tolerate it. The more the better, because you just pee out vitamin C.
When you say zinc, are you talking about those little dissolvable, like Zycam? Like Zycam.
Yeah,
Okay.
Zycam tablets, and then you can get the magnesium as well. The magnesium, I think, facilitates the zinc getting in the cells, and so. But those things are all things that will help, possibly, keep you healthy.
All right.
It won't hurt.
Dr. John Edeen, thanks for coming on this video. Ben Branam, thanks for coming on. I appreciate it. And I think before this whole crisis is over, I think we got to do a part 2 of this. What do you think?
Anytime you guys want to do it, me.
Is that a deal? Part 2 coming up?
Oh, absolutely. Give it a few weeks. Let's see where we're at.
Give it a few weeks to see where we're at.
I think that what's going to help us is when we start getting more available testing kits and we start doing significant numbers of people testing. Then we're really going to get an idea of who has the virus and who doesn't. And once we do that, then I think we can probably focus our efforts on people who have the virus and those that have a high risk. And I think that's how we get out of this hole.
Sounds good to me. Thanks, guys.